Video number 6. Counseling lessons. To diagnose or not? Experts have always required to have things under the precise terms. But is it really necessary to diagnose something what is going to disappear in a few months? Using my method, stuttering can be removed in the course of several weeks or months. Why should you undergo various medical treatments, examinations and tests, etc., when nobody can guarantee your recovery? The symptoms of stuttering can only be traced at the moment, when the other vibrations are observed on different optical or acoustical receptors. Neurologos therapy concentrates on the very moment of the origin of the human speech in the forebrain area. The most important prerequisite here is to take the right posture. One. Breathing. It is started from the midbrain and manifested in the respiratory ligaments. They are in the open position, and in the breathing muscles, that are the mouth, tongue, cavities, larynx. 2. Swallowing. It is started from the midbrain and manifested in the swallowing ligaments. They are in the closed position, and in the masticatory muscles, that are the teeth, lips, tongue, palate. 3. Voice and speech. It is produced by the ligaments transforming breathing in to breathing out with voice. The vocal folds are in the narrow position here, and by the articulative muscles, that are the tongue, lips, and cavities, that form the breathing out with voice into a comprehensible shape. How do the brain and speech organs work? The functions of breathing and swallowing are superior to speech. They are activated psychosomatically from the midbrain. Speech comes from the consciousness and is supported by the unconditioned subconscious. When the conditioned stimuli leave the border between the brain and body, then they cannot be controlled any longer. If they are sent in discoordination, it results in discoordination in the speech organs. If they are sent in coordination, it results in coordination in the speech organs. Stuttering can only occur during the transition from the open respiratory ligaments to their narrow position. Discoordination in the speech organs can only be prevented by taking the right posture in the forebrain cortical area during the speech start. Person afflicted with stuttering should be aware of the right posture during the transition of ligaments from the open to narrow position. The supportive moving of fingers can be performed visibly, with just a little visibility, or even in secret. Eventually the afflicted person will perform the finger moves in his or her imagination only. Basic speech rate 1. If you pronounce the word 27 in 1 second, then the speed of your speech will be defined as 1. The muscles forming the breathing out with voice will properly activate the relatively closed consonants and the open vowels. The person afflicted with stuttering should speak at the rate of 1.5 for some time, until he or she fixes the inborn subconscious. Later on, the speed of speech will return to the rate 1 by itself. The speech rate has no influence on the cause of the speech defect. The stuttering person just wants to be quickly through the speech. Man either receives or sends signals from the brain. In the picture, the received ones, the centripetal, are represented by faces, while the emitted ones, the centrifugal, are represented by vase. If the process goes only within the brain, then it is a speech of mind, that is wordless thinking, reading, observing, etc. If someone speaks to us, then the signals go through the optical and acoustical receptors. When responding to someone, the signals always start from the forebrain and then they travel through the speech cortical area to the border between the brain and the body. If the signals leave the brain in coordination, then we do not stutter. If they leave the brain in discoordination, then it leads to stuttering. Let's make an experiment. Try to see both the vase and the faces at the same time. Nobody can manage that. From stuttering to fluent speech. My daughter started to stutter just about a week ago. She is not able to start speaking without repeating the first syllable several times. Sometimes she even says it silently to herself when she cannot proceed. My brother started to stutter at the age of 3. When he was growing up, I can remember my parents trying to do everything that was possible, a herb doctor, logopedics, breathing exercises. My little son started to stutter when he was about 1.5 years old. I was very unhappy about his stuttering. Fortunately, it passed as quickly as it started. As I had been stuttering myself, I had been going through the early years of my son and daughter with a great concern. Everything went off without a hitch. Should you find out any symptoms resembling to stuttering, then start neurologos therapy. You will manage everything by yourself. Do not wait for all sorts of medical histories, examinations, observations, etc. Professor David Shapiro claims that he had been afflicted with severe stuttering for 20 years, and that he managed to overcome it very successfully. He says, "It still happens to me, though very rarely, that I don't have full command of my speech. For many years Buddy had been the only living creature that I could speak fluently to." Why? Please explain or else say nothing. It has been proven that people afflicted by stuttering can speak fluently with their pets. Why? Please explain or else say nothing. He says, "Nobody can tell me that I don't understand his or her suffering." In fact, he really doesn't understand it. It is just a symptomatic mystification made to his own liking, but not to the true picture. It is very difficult to imagine how it is when you cannot speak. How it is when you exactly know what you want to say, but cannot express it verbally. If the cause of stuttering was unknown, then I would agree. But with the cause of stuttering being known, the stuttering person can always speak normally. Stuttering therapy deals directly with the human nature. Thoughts and feelings must lead to changes in our behavior, and they must be of permanent character. Sure. A 3-year-old child can fully understand the human nature. Summary: Professor David Shapiro has been still afflicted with stuttering. I saw and heard him in the city of Brno with my own eyes and ears. When he can't go on with the speech, he starts saying, "Okay, okay." Stuttering is not at all a complicated problem. The problem has been deliberately created, as stuttering has been a rewarding, long-term profitable business. When you recover, it is said to be thanks to the experts. When you don't recover, then nobody is to be blamed. Professor Shapiro went his own way, and he did not reveal the secret cause of stuttering. Every stuttering person can easily disprove his findings by clear facts. For example, the soft start, disorder of speech fluency, correct breathing, etc. He definitely doesn't make the statistics of his success rate. Neurologos therapy doesn't use exact methods. Grandpa, you had been stuttering for 45 years. Yes, from the age of 5 to 50. So, you had been researching for 30 years, and then you cured yourself with your own method. Yes, I did. I am 5 years old and have only been stuttering for 2 years. You know, grandson, it is like the Russian roulette with the experts, Isa, Fsa, Elsa. You follow their instructions, you won't recover. You don't follow their instructions, you will recover. Nobody can promise you anything in advance. They are like fundamentalist believers. They still insist on defining the stuttering as a disorder of speech fluency. They regard me as an accentuated personality. And me, Grandpa, are you going to cure? No, stuttering is neither a medical nor pedagogical problem. Stuttering, boo-boo, has come, and stuttering, boo-boo, will leave again by itself. Can you see the animation? Normally, the boo-boo is hidden. And I will show it to you. And do you know, Grandpa, where I have it?
So let's make a test. Try to say D. Use the tip of your tongue. Agnes. Use the laryngeal epiglottis. Cow. The ligaments transforming breathing out into breathing out the voice are active here. Say paper. Use the lip muscles.
Most importantly, all stuttering boo-boos have their focus in the frontal areas of both hemispheres. Main thing is, Grandpa, that I am going to speak without stuttering. No person with just a basic education has ever been able to argue with an expert in a particular scientific branch. Nobody has been willing to argue with me about the therapy yet. I haven't had any opponent for nearly 40 years. Will you try to discuss it with me? Will I see any reasonable debate?